guest today on Heart of the Matter was actually on the show back in 2019, right before the pandemic hit. I cannot believe that. 3 years. She is the author of Asking for a Pregnant Friend and Feng Shui Mummy. She is also a certified parenting coach, hypnotherapist, birthing doula, HypnoBirthing practitioner. Wow, she's been very busy. A founding member of the Ujjayi Valley Birth Collective, past IVF coordinator, and contributor to Working Mother, Fit Pregnancy, Pregnancy and Newborn, Disney's parenting site Babel, Elephant Journal, Cosmopolitan, Red Book, Woman's Day, Good Housekeeping, Scary Mummy, Natural Solutions, Natural Mother, Your Tango, American Baby, Green Child, Huffington Post, and more. She also volunteers for a program where she offers in-home support to parents of newborn babies, specifically single mothers and those with babies that have special needs. She is one of my favorite women to interview. She's the one and only Bailey Gaddis. Welcome, Bailey.
Hi, thank you for having me back.
Oh, my pleasure. I'm sorry it's been so long, but you have been very busy. What a
Yeah,
resume.
very busy.
A working mum as well. How do you manage all of this?
I have a lot of help. I live next door to my parents.
Oh,
So my
perfect.
mom, I'm so lucky. She retired when I got pregnant with my daughter, and so
Oh,
she is my full-time helper with the baby. So
oh, I just got goosebumps. How
yeah,
beautiful. And how
yeah,
lovely for the children too to have grandma or nana, whatever you however you refer to her,
yeah, Nana. Yep,
Nana,
yep.
in their lives so predominantly. I think that's beautiful. Oh,
Yeah, yeah. It's so
congratulations.
sweet. Thank you.
Yeah. So we know how much I loved Feng Shui Mummy at creating balance and harmony for blissful pregnancy, childbirth, and motherhood. Absolutely love this. And then you came out with just recently asking for a pregnant friend 101 answers to questions women are too embarrassed to ask about pregnancy, childbirth, and motherhood. Yeah, I love it. I mean, once again, sounds like an obvious book that has never been written. I mean, something that we all need, right? Well, how did
Yeah.
this all come about? What inspired the second book?
Yeah, so I think the seed for it was actually planted in my first pregnancy, gosh, almost a decade ago now.
Okay.
And I had so many questions,
Mhm.
and many of those questions were questions that made me feel embarrassed,
Mhm.
shame, and so I ended up not asking them.
Of course.
But I, of course, Googled a lot of the questions,
Yeah.
and for the ones that were more like emotional, I found answers, but a lot of those answers were like on chat rooms, forums, and they were very judgmental and they
Oh
just
gosh.
expounded that shame. And
Right.
then a lot of the questions that had to do with the body, I found answers, but they were conflicting, a lot of times not from a great source.
Mm.
So when I started to think about what I wanted to do after Feng Shui Mommy, I started to think about those questions and then all of the questions that I had received from my clients since then. A lot
Mhm.
of them were those same questions that you feel like you have to whisper.
Uh-huh.
And so it evolved from that, and wanting to provide an accurate source for women to receive, the answers to a lot of those questions that are unfortunately considered taboo.
Yes, and I guess not only are you answering questions, but you're bringing comfort to women to make them realize that they are natural. This is natural. This is normal to have these questions. I'm not unusual or weird, or I shouldn't feel ashamed. I
Yeah.
think. Why do you think that it's been that there's been such a taboo and around motherhood? Why are we so hush hush about this? Why is it only just now coming to light that we all have similar fears and thoughts and worries? Why are we
Right.
being so quiet about this? Do you think?
Yeah, I think a piece of it is, again, that fear that what if I'm the only one? If
Mm,
I'm the only one, I'm going to be judged. In the case of some of the questions that I navigate in the book, having scary thoughts about the baby, even arousal during breastfeeding,
mhm.
some of these questions, I think women feel like if I'm open about this,
Yes.
I'll be labeled as a bad mother or somebody will try to take my baby away, so there's a spectrum, right?
Sure.
And then some of the questions, they force us to really look within, to really get honest about like who we are
Mhm.
and how we, perceive not just ourselves and motherhood, but the world. So
Yeah.
there's so many different layers to a lot of these questions. And, I think obviously like society too, like if there's topics that you don't hear talked about a lot in
Mhm.
media, then you're more shy to be open about it. And thank goodness that's slowly changing.
Yes.
But especially the questions about sex, right?
Oh,
Even though for a lot of women, sex is what equaled the pregnancy.
well, right.
But
Exactly.
right?
Right.
But women are like a lot of people feel like, oh no, like sexuality, sex, and parenthood have to be totally separate, which is
Correct.
wild. So that's
Right.
one reason why I write quite a lot about sex in the book.
You do, and I think it's great because, as you say, a lot of people are trying to work out how do we be sexual beings while being a mother or being, pregnant. And so, what are the examples of some of the most common taboo questions that you've heard as a birth doula and in your work? What's the theme that keeps seeming to come up? Do you think?
Yeah, so like as I said with with sex, for example, what are comfortable positions during sex that I can use when I'm really really pregnant?
Uh-huh.
One again, the really common one that makes women feel sadly so much shame is the one about experiencing arousal when breastfeeding,
Mhm,
even though this is a totally normal phenomenon.
mhm,
It
mhm.
causes that release of oxytocin, nipple stimulation, all these circumstances
Yeah.
that result in the body
Mhm.
feeling aroused. But again, it's not like people could think like, oh, does that mean I'm having
Fun.
sexual thoughts about my baby?
Right.
Absolutely
No.
not. It just means your body is having a totally natural response. One
And
of the other ones, oh, sorry, go ahead.
Oh, sorry, I was just gonna say, I would say that that's nature's beautiful way of helping mother bond with baby and encourage the breastfeeding.
Yeah. Yeah,
Yeah,
exactly. It makes you feel good, right?
right,
And that
right.
if you feel good, you want to breastfeed more. And it's just, our brains putting that sexual label on it, right? Because we're used to
Mm,
that feeling of arousal
right,
being connected to sex, but it doesn't have to be connected to sex.
got it.
It can just be a good feeling that the body is producing.
Mhm. I wonder if that's a subconscious reason why some women have difficulties breastfeeding. I wonder if that could be a block if they're thinking, "Oh, I shouldn't be feeling like this," or
Oh,
one of the reasons.
yeah, no, absolutely. I get messages from women all the time that say that was one of the reasons
Right.
why they
Mhm.
stopped breastfeeding because they felt so embarrassed, so ashamed every time that would happen, which is so sad because
I
again, it
know.
it was natural,
Natural,
but
right.
yeah, yeah, so you're right.
Okay. So who do you think the book's for, do you think? I mean, I think everybody's becoming more open about talking about feelings, reflecting, self-care. I think it's very pertinent. The timing is perfect, I think, for this. I think everyone's ready to have that conversation. Do you think
Mhm.
this is for second time mothers, first time, or it doesn't matter? Who do you find
Yeah.
women are resonating with?
I really think it doesn't matter, if
Mhm.
like how experienced you are, because I wrote the book when I was pregnant with my daughter. It was such an interesting process writing it because when I started writing it, my husband and I were trying to get pregnant.
Right.
We got pregnant, we miscarried,
Oh my
and then
God.
we got pregnant again. So I went through like
Oh
all
gosh.
these different experiences with pregnancy and motherhood while writing the book,
Right.
which was so intense, but also so helpful for like really,
Uh-huh.
really being able to empathize with the women that are hopefully reading the book. But so long story short, I was amazed at how much I didn't know
Mm.
when I was writing about these topics, as somebody that had been a mother for, 9 years, that had been teaching about this for almost that same amount of time.
Right.
And so that's why I feel like, yeah, it can be, of course, helpful if you're a first time mom, but even if it's your second, third, fourth,
Yes.
hopefully you can still, yeah, find a lot of benefits in the book.
Well, that sounds great because I guess, as you say, it's a massive learning curve,
Yeah.
a big journey. So we're always learning, aren't we? And learning new things about ourselves. And every baby's different, every pregnancy, as you would know, different experience. So, well, congratulations on your new little baby. She just turned 1, I believe.
She did. Yeah,
Oh,
little baby Grace.
oh, how beautiful. Perfect. So, what do you think? How does Hollywood play into this with fear, do you think? And watching movies, it's always an emergency, and
Mm.
when women going into labor. And do you think that this plays on women's minds subconsciously or consciously?
Oh yeah. Yeah, no, that's a great question because, for most of us, the first images of pregnancy, childbirth that we were exposed to was through media, right? And I when I was going through my hypnobirthing, childbirth ed training, I remember one of the teachers said, the Hypnobirthing Institute submitted these some videos to a reality show that was being made about childbirth.
Mhm.
And the producer said, sorry, we're not going to use them because they're too boring. The women are just like so calm and there's like
Yeah,
not an emergency happening. And
no
so I felt like that
drama.
was
Mhm.
so telling, right? It's like you don't see, or often you don't see these peaceful, calm, really authentic, depictions of pregnancy and childbirth in the media because it's too boring.
And
So
even
when
the
you see
orgasmic birthing I've heard about, is that true? I've never had a baby. Wow, so it is possible to have these really amazing, beautiful, yeah, that's the thing. We always see these dramatic, life-threatening crisis,
Right.
which is really scary for us women, I think, because it goes into our subconscious from a young age.
Oh
And
yeah.
we're lucky we have people like you that are able to help other women navigate their birthing experience and turn it into something really empowering.
Yeah. Yeah. Thank
So,
you.
how do women feel empowered, do you think, when it comes to motherhood? What steps can they take to really turn this into something magical and feel natural?
Yeah. Yeah. So I think it is a combination of educating yourself and then tuning into your intuition. So, it is important to seek that information, but then as you're processing that information to like really connect with again your intuition. What seems to resonate with you. So I tell
Mhm.
women in my classes that, are reading my book, it's like you don't have to 100% agree with everything that I'm saying, all the information I'm providing. I want you to consider all of it and then just pick out the pieces that you feel would work for you.
Yeah.
Adapt the ideas that I'm giving you so they work for you. And so I feel like that can go into motherhood as well.
Mhm.
It's like, don't let anyone tell you exactly how you need to do it because you are unique, your child is unique,
Mhm.
and it's going to feel, more empowering, more authentic if, again, you allow yourself to trust your instincts.
That's
That's so
really,
crucial.
oh, what, absolutely. I really loved it. That was your message that came across quite passionately in the book, was about tuning into your intuition. And even when it comes to deciding on your birth providers, your healthcare team, that's
Right.
so important. And I guess women can get into their journey 6 months into pregnancy and realize, hang on, I'm not resonating with this doctor or this. How do they try and make that change so late in pregnancy, do you think? And should they? What would
Yeah.
you recommend? I guess it's individual, but what would be your advice?
Oh yeah, no, I think if a woman, realizes my care provider really isn't making me feel comfortable, I don't feel like I can ask them anything, especially if, when they come in the exam room, you kind of like clinch up. You don't want that to happen during labor, right? You
Oh,
want
okay.
yeah, you want them to be a source of calm and even, look, they might be a perfectly fine doctor, for example. They might be perfectly nice, but for whatever reason, you just don't connect with them.
Right.
And I know, like I know it can be so uncomfortable to like quote unquote fire a doctor or a midwife,
Mhm.
but that bit of discomfort, if
Yes.
it means that you're then going to end up with somebody that you really feel great about, it can make such a huge difference in your birth experience, because
Yes.
again, the people in the space and the people caring for you, they can make a huge difference regarding how you feel during childbirth and how long it takes. So I tell women,
Yes.
definitely change if you're not resonating with your current care team.
Definitely. And even the impact, I guess, after the actual birth, whether it was traumatic or whether it wasn't, or whether that can really impact how you are as a mother as well, and flow onto the child. So trusting your instincts, I think that's coming back to your intuition as a woman, and that is empowering, isn't it?
Yeah. Yeah, no, absolutely. It's all about that.
So what do you think the biggest takeaway is for women when they read this book? What's the message that you really hope, obviously trusting your intuition, but is there anything else that you really, why you wrote it? What was your exact mission, do you think, that you wanted women to understand?
Yeah, I think one of the big things was pretty much like no matter what your questions are or what you're thinking or feeling, I can almost guarantee there's probably thousands, even hundreds of thousands of other women out there that are having a similar experience. So I never want a woman to label herself as like other than or
Mm,
oh, I'm a bad mother because of this. I really want to normalize the full spectrum of experiences, of thoughts that women have throughout this journey, and just to really really know that you are not alone. You are part of this massive sisterhood that is behind you and supporting you, even if you can't see us. We're there.
well, that's it. And I think this also ties into your first book, The Feng Shui Mummy. I really think that this is a continuation of, and that you can incorporate aspects of
Yes.
what you wrote about. I really loved your first book as well, about creating the birth sanctuary, for example.
Yeah.
And that's even about, I guess, emotionally as well, right? And that's what you're talking about, addressing your fears. This is the sanctuary. You're the
Yeah.
mother, the women that are, that's the womb is the first home, isn't it, for baby? And then if you're not settled, and so it is all tied in, do you think? The first book
Oh, oh,
really,
oh, of course. Yeah.
yeah.
I mean, and that's why, yeah, that first book was so about this holistic perspective of childbirth and thinking
Mhm.
about, the mind, body, spirit, the energy that is around and within you, because like you said, it all ties together.
100%. And what do you think about women preparing for pregnancy? I've heard about like techniques like the Mayan abdominal massage and putting the womb back in place, that it could be out and we don't even know it, and that can affect conception, and chakras. I mean, you talk about all the energy, and I think women are becoming more open to that. How do you think the sacral chakra can impact conception and pregnancy?
Oh, I think it can have such a huge impact. I was amazed, when I started doing more work with that, through meditation. I started to see an acupuncturist every week. He was also an herbalist, and when I really started to look beyond like, okay, it's time to have sex, and my
Yes.
cycle, and started to look more at kind of that spiritual alignment, that sacral chakra. What could I do beyond just having sex? And then my acupuncturist, we talked a lot about really opening myself up to that little being who was meant to come to me.
Mhm.
And I started seeing him after I had the miscarriage. And so, there was so many blocks and so much going on for me. And I think, utilizing that alternative medicine is is what allowed me to get pregnant fairly quickly after the miscarriage. So, oh yeah, I think absolutely, going again beyond just the physiological process of pregnancy, or and fertility
Yes.
can be really crucial and so helpful.
Definitely. I'm really sorry you went through that experience too, but I'm so happy that you've got your beautiful girl, and yeah, it's all worked out. So let's talk about a couple of questions in your book. I'm gonna find something. Oh, I love all these. Okay, let's talk about labor, I guess. And should women have natural birth, drugs, and obviously not the word should, but what are your recommendations? I guess it comes back to individual choice. Do you feel that women can be competitive? Like I had a natural birth, or when it comes to cesareans, and how do women navigate the actual, should they or shouldn't they be taking drugs, and how do you
Yeah,
feel?
I think women are definitely influenced by their community, even if the truth is their community would support them regardless of what they do. But for example, where I live, it's this adorable town in Southern California. Um,
I hope I said that correctly. Is it Ujai? How do you pronounce
it's
that? Oh,
Ojai,
hi.
but
I
it's
beg your
but you would
pardon.
never know. You would never know that from the spelling, right?
Right, right. Beg
Um,
your pardon.
yeah,
Oh,
my GPS always calls it Ohio. Um,
hi. That'll lead you somewhere else, won't it?
yeah, right. But yeah, so in Ojai, home birth is really common, unmedicated birth,
Mhm,
so I can totally understand, women in this community feeling like, oh, if I have an epidural or a C-section, I don't really want to tell anybody.
mhm.
Or, I'm originally from Texas. And so in Texas, it's super common to have an epidural. And you might have people say, you're crazy if you don't do that. So,
There's the shame again too, right? Yes, yes.
right, right. So your community absolutely impacts you, what the choices that, your friends and family members made during birth.
Mhm.
And then, to realize, to really figure out what would work for you, it goes back to that knowledge, right? Equip yourself with knowledge. That's why in the book, I included a question that does look at, okay, what are the potential pros and cons of labor drugs, like, like getting an epidural, like having Pitocin, so women can have all that information, not to like scare them away from it, but for them to go into the situation with their eyes wide open, you
Right.
know. So if they're feeling like, yep, no, I've thought about it, I've gotten all the information, an epidural feels like the best thing for me, great.
Yes.
If they realize that a home birth feels like the best choice, amazing, so to just get all that information and then again make the choice that feels right for you, not even your partner, not your mother, but you, because it's your body, you know
Exactly. And you talked about that in the book as well, about some women not wanting their partners present during the birth, and can I tell him, can I even can I even make that decision? Once again,
Mhm.
I guess you feel that it is up to the woman. How would you recommend someone navigates that situation if they really don't want their partner present during the actual birth process?
Yeah, so obviously this can be a
Mhm.
tricky one,
Yes.
but I think number one, women should really get honest with themselves and think about, will my partner being there provide comfort or extra stress?
Right.
Like in the book, for example, I write about one partner that like just being in the hospital would make him like really woozy. And
Mhm.
so, his wife was thinking, okay, am I going to be having to worry about you like when I'm
Yes.
going through labor, and so again in that situation it's not all about them like having a bad marriage or her not trusting him. It's simply
Sure.
about, a factor of him not feeling great in hospitals, so there are so many legitimate reasons why a woman might feel like their partner shouldn't be there. And
Mhm.
so what I recommend is talking about it, right? Like as soon as you have that thought that, like maybe this is something we need to discuss, so discussing it with your partner, seeing how they feel about it. They might be like, yeah, you know what? I agree with you. Like maybe I
Yes.
should just come in right after the baby is born. Or if they really want to be there, you can work together to figure out a solution that works for both of you. So to
Yes.
communicate ahead of time, so it's not like during birth itself you're saying you need to leave,
Get out.
and getting into that like conflict right then and there. So it's definitely a conversation you want to have ahead of time. But again, to know that it is the woman's right to let her partner know if it could be an issue with them being there.
And even in the birth process, you giving birth communicating whether someone needs to knock before they come in, like any of the care providers, like even setting some boundaries and what's going to be making you feel calm and comfortable. I didn't know that that was even a possibility. I thought that nurses and doctors would just come in and do what they have to do. I really loved that you said that actually, hang on a second, it can be within your hands who comes and goes
Right.
and how. What do you recommend when it comes to that? Politely communicating something like that.
Yeah, so number one, remind yourself that you are a client and not a patient, right? You're
Right.
just coming into the hospital just in case you need extra care. And so, what you can do is number one, put it in your birth preferences, saying, look, I'm not saying you can't come into the room, but I'm saying, please knock and wait for permission to enter before coming in. I
Love
also recommend women printing out a sign that they can tape to their hospital door saying, please knock before entering.
it.
Please use calm, low voices. You do have a right to dictate kind of what kind of energy the person is bringing into the room.
Yeah.
It can be really jarring when you have this like soothing music playing, you're really calm, and a nurse walks in talking really loud. She's
Yes.
really abrupt, that can totally throw off the mood. So it is absolutely you're right to dictate kind of what the vibe is in your
Love
birthing
that.
space.
You did talk about that as well in your first book, The Feng Shui Mummy, about language, not just
Mhm.
breath, but the power of language and how we get surges rather than contractions, and how that can really, so that ties in, I guess, with the people that are coming in. Yeah,
Yeah.
if they're coming in a rush and panicking and abrupt, yeah,
Yeah.
that can really take you out of your zen zone and and then upset you, and then that can obviously have implications as well.
Yeah.
So,
Yeah.
yeah, so let's talk about breath and finding that calm. How do
Hmm.
women navigate that when they're in pain, when they are scared that,
Hmm.
what happens?
Yeah, so really, I feel like the breath is one of the most crucial elements of having, a happy, healthy birth experience,
Mm.
because it is almost impossible to go into that fight, flight, or freeze response when you're taking deep breaths.
Mm.
So I tell women, it's like no matter what else you're doing during birth, just make sure that you are taking long, slow inhalations in through the nose, long, slow exhalations out through the nose. And I do teach specific breathing techniques in both books that can be really helpful. But I tell women, even if you can't remember the exact formula for those breathing techniques, it's fine. Just focus on taking deep breaths. And those deep breaths are going to, again, help you get out of that fear response, out of that anxiety. And it helps to ensure more oxygen is getting to the uterus and the baby. So in a physiological sense, you're also really supporting the baby and your body and having a quicker, healthier birth by continuing to breathe. So if that's like the only thing that you do during labor, great. Like you can
Yes.
forget all the positions, all the
Yes.
affirmations, all of it. Just make sure you're taking long, deep breaths, and you'll have a much more positive birth experience.
I love it. What excellent advice, Bailey. Once again, always amazing to talk to you. Are we going to get another book from you? Are you in the process of writing? You are. Oh,
I
that's
am.
exciting. Well, we're looking
Yeah.
at that. Where can
Yeah.
you find Asking for a Pregnant Friend?
Yeah, Asking for a Pregnant Friend is available on Amazon, Barnes and Noble, Target, everywhere that books are sold.
Yeah, and your website is
It's
Bailey.
BaileyGaddis.com.
Okay, perfect. Well, I'll put a link to that in our video on YouTube as well so people can find you.
Thank
Thank you
you.
so much for your time. Congratulations once again,
Thank
and wishing you
you.
a very Merry Christmas and Happy New Year.
You too. It was such a pleasure.
Thank you so much, Bailey. Hope to talk to you when your next book comes out.
All right. Yes, looking forward to it.
Okay, thank you. Bye bye.
Thank you. Bye.